this is Breanna. Welcome to our channel. This is our very first episode. So of course it's going to be polished, completely put together, and answering all of your questions.
And I'm Jason, and today for our first episode we're going to be really diving into what anxiety is. A lot of us throw this word around and sometimes make it synonymous with stress. And so what we're going to do is try to define it and what that means to use this word or even be diagnosed with this mental health condition. We're going to review the things that it can lead to. We're also going to go over the regular and sometimes less regular uses and tools that can help improve those of us with anxiety. I myself suffer from it. I'm in a much better place now, but if I'm not on my A game, it can still come out sometimes. And then at the end, we'll go over how to work with professionals in your community. An acupuncturist like myself, a therapist like Breanna here, or many other people that can help you with this issue.
The way that I see anxiety is it is the tension between emotions that are bubbling up and thoughts that are coming in and kind of squishing on top of the feelings. So the tension that's created between the two of those is what I refer to as anxiety. Once you get to understand what those thoughts are and once you get to understand what the feelings are, then you can begin to pull them apart and work with the anxiety in a new way. Anxiety manifests for everyone a little bit differently. So some people will come in and just say they have physical sensations. So they'll talk about anxiety in terms of racing heart, feeling shaky, shortness of breath, like a cloudiness or an overwhelming kind of feeling or sensation.
Yeah, it's similar in the Chinese medicine outlook of anxiety. There's many different ways in which it manifests, but typically we would talk about the nervous system being overwhelmed or there being a hyperactivity in the nerves and many other biological functions, which can, of course, can get in the way of many activities of daily living, from working to sleeping to being creative or having relationships, or even being able to regulate yourself when it comes to simple things like eating or getting out of bed. I know a lot of people have more symptoms at certain times of day, understand that things can stimulate their symptoms, maybe certain foods can do that, maybe even certain people or certain environments based on what might have gone on in their past or other biological problems. I dealt with chronic fatigue, which really stimulated my anxiety.
There's an anxiety creates a way of thinking that kind of feeds on itself. So it creates a rigid thinking that tells you to live your life in a black or white way, because you're constantly assessing, that might make me anxious, that might make me anxious, I don't like it when I do this because I feel uncomfortable, and that builds on itself because it works, if I avoid that, I'm not as anxious,
right.
And so then you begin to kind of buy into the anxious mind, the anxious thinking, and feel like, okay, well that keeps me safe, that's a good way to think. But over time, your world becomes smaller and smaller when you live with anxiety. They say, I am not going outside very much. I have a very small routine that I'm living. I have, only a certain number of people I interact with. And so you stop taking risks. You stop really opening yourself up in relationships to new experiences. If you look to the extreme, you see folks that, their anxiety turns into agoraphobia and they cannot go outside, or phobias that kind of get so life-altering you can't cross a bridge, or you can't, do certain things because you've gotten so rigid. You've convinced yourself doing those things will be just too much. We create these really well-worn pathways in the brain, and that's where the rigidity comes from. And then over time it becomes very hard to step outside and light up a different pathway in the brain.
In my office, I'll often see many people coming in with all of that, and then I help them connect a lot of their physical issues to this way of being in the world. So many people will say, devoid of being diagnosed, I'm anxious, I'm stressed, and may not recognize it as a mental health condition, but will come in with physical symptoms. And so many people will usually enjoy somebody like myself connecting dots between what's going on in their digestion or their immune function or lack of function and the mental stress and anxious thinking and anxious activity in their days and their lives. And then, of course, the mind affecting the body affecting the mind, and then creating this sort of spiral, which can certainly get out of control. And I remember mine getting the worst when I was doing a lot of extra, mental work, and my self-care really wasn't at its peak. And everything kind of fed each other, and it really felt like very unmanageable. And so I was happy to get the help that I did from my acupuncturist and my therapist. So we've gone over some ways in which anxiety can make things worse, ways in which we can start to change abnormal thinking. I tend to work with people, yes, on ways in which they can, think a little bit differently, but I will try to engage their bodies a little bit more. I find anxiety to be an overly mental aspect of really what one of my friends calls future tripping, really tripping on one's future over and over again, or one's present or future. I've found that depression can often be about the present or the past in general. It's a very general statement. But allowing people to start engaging more with breath work, exercise, movement, dance, really anything that gets them out of their mind and the thinking aspect and more into their body again. And that's why acupuncture works so well, because it's very much a physical experience which affects both the mind and the body.
Things like walking and yoga and breathing and also journaling are also really good for right-left brain communication, so helping develop and stimulate those new pathways.
What kind of journaling would you recommend somebody do to help with their anxiety?
I typically recommend just word vomiting. So oftentimes...
What is that?
Okay. Oftentimes, if you're anxious, you'll be having those thoughts coming down on the feelings. So you'll be second guessing everything that you're writing. You'll want it in a certain structure. But if you can set aside wanting to write anything that makes sense, and typically you can start your stream of consciousness, my therapist told me to journal, I don't want to, just without really thinking about it too much, just trying to write anything that comes to your brain. I know one thing that we both typically will sometimes recommend is not holding on and cherishing, every page of your journal,
right.
But get a journal that you can rip out at the end and shred it, throw it away, because you don't want to get too attached to it. It's just getting that stuff out.
I tend to recommend doing this once a day for at least 10 to 14 days to start to generate a really decent habit. Most habits take a good month or longer to shift, but often this mental vomit type journaling can really start to change things in a matter of days. I also add to the vomit part, if things are stimulated that you do want to hold on to, like, oh my gosh, I forgot to blank, then you might keep a separate list that you can also go back to later. Doing this around bedtime can be helpful for those of us where anxiety makes it really difficult to fall or stay asleep.
Mm-hmm.
So done right before bed on a regular basis can help. Keeping that mental list aside and then the vomit list right until you literally can't write anymore. Tear it up, throw it in a garbage can outside your house, and be free of those feelings forever. If someone's interested in seeing a therapist in their area, what are the types of things they should look for?
Reach out to a few different therapists, so you can find them on different kinds of directories online, and you can actually plug into these directories anxiety in your search option, so you have ones that are skilled in doing that, and then pick a few and interview them. Have a conversation and ask them how they approach anxiety, what the treatment plan would look like, and get a sense, from that, what feels like a good fit for you.
I want to comment on interviewing and having a treatment plan. In my experience, I have found many therapists and possibly even a lot of acupuncturists or even medical doctors sometimes don't have a treatment plan, and you'd expect that from any kind of medical professional. Therapists especially can sometimes be stigmatized for really keeping people on kind of a circle where things don't really progress. And so I think right at the outset, if you're looking for somebody in the interview, which should be a process where you ask multiple questions other than do you treat anxiety, you want to get an expectation of how you're going to be treated and the process that you're going to be undergoing and how you might measure improvement. Rather than just saying, I heard, you're great from a friend, let's meet each other. That's a perfectly great, way to start things. But it's really helpful before you've met anyone, whether it's my specialty, hers, or anyone, to interview, get your questions answered before you show up. And if somebody's not willing to do that, that may be an issue for you. I tend to recommend people do that.
And it's really good to make sure you and whatever practitioner that you're working with are both identifying the problem in the same way. So if you're going in and you are really clear that you're wanting to work on anxiety, but they're sending you a lot of messages that you should be working on something else, or they see the problem in a different way, then it's not going to be very productive. If someone walks into your office and they say, I need a treatment because I'm feeling really anxious, how you deal with anxiety?
I like to ask really everything about what's going on for them at the moment and even their history. So oftentimes people will show up with a diagnosis or a word or a symptom and say, make that thing go away, and we'll certainly talk about that. But I actually quickly move to a bit of a broader place where I speak about the rest of their life and what's going on in their body and their mind. And so that I can fit this one little piece into a much larger picture where, again, I can connect dots between their physical symptoms, what's going on for them emotionally and mentally. Because truly the medicine that I practice, and I think I can speak for you too, is really about improving people's lives, not just their symptoms.
Right.
Often people will show up looking for their pain to go away and might treat you or me like a walking Band-Aid. Feel good for a minute, disappear, and then repeat the process. And our goal is to truly get people to slowly and steadily, or quickly and steadily, see improvement. And in working together, I have noted that the patients that have worked between us tend to go a little quicker, a little farther than those that might see only one of us alone. So really, truly working on the mind and body simultaneously can have exponential benefits.
I think anxiety is not all bad. Sometimes it's good to have anxiety. It starts as sometimes a coping mechanism, and then it just kind of goes off the rails. So initially it's protective and it's useful, and then down the line it becomes sort of bigger, badder, stronger, and develops a life of its own. Oftentimes people with anxiety are thinking in black and white. It's good or it's bad terms. It's not good or it's not bad. It's, at one point it was good, and then it became something else.
Pain, like anxiety, can also be good because these are truly opportunities for change and growth, and many people unfortunately have a hard time asking for help and seeking improvement because they feel it's not possible.
Right.
And so talking to somebody, interviewing somebody can be the start of truly a life change. And we want to communicate to you that you're not alone. There are so many people suffering the same. I went through it myself, still need to manage it to this day. And it's because I know about this personally and professionally, what is possible for yourself and for those around you. If you happen to know anyone who needs help like this, do share this video with them. We're on a goal to get our first 100 subscribers, so if you're getting value out of what we're saying, hit that subscribe button. Thanks so much.
Thank you.